everyone. Welcome to KHA Homeopathy Study Group Pro Bono webinar. Good morning, good afternoon, and good evening. So nice to see many of you from different countries and different time zones. Before we start our webinar, always thank Universe for giving us this great opportunity. And Dr. Sweta Singh, our KHA Chief Administrator, will start the session.
Hello everyone, myself Dr. Shreepad Singh, KHA Chief Administrator, welcomes our respected speaker, Chairman and CEO Kavita Ma'am, KHA volunteers and all the attendees to KHA webinar. I would like to take the opportunity to introduce KHA Homeopathy Study Group to all of you. KHA Homeopathy Study Group Pro Bono was organized and founded by homeopath and humanitarian Kavita Kukunur, President and CEO of Kavita Holistic Approach, KHA. This study group is intended to be an offering from Kavita to the homeopaths around the globe. Sharing, goodwill, and solid clinical work within the classical model are foundational principles for the KHA. KHA's mission and vision are very unique to inspire young homeopaths, mentor, provide excellency for educational purposes using holistic approaches via webinars, which are based on principles of classical homeopathy and provide professional continuing educational homeopathy credits for practitioners. We provide merit certificates for spreading the light of homeopathy around the globe. Dr. Kavita is a member of Kevin Friendly Foundation, a non-profit organization that helps to serve poor people in greater needs in India. She is nationally board certified by Council for Homeopathic Certification (CHC) and Achina CPT provider and serves as the associate editor for the Homeopathic Heritage. She is the recipient of Martha Ullman Community Service Award by National Center for Homeopathy and Best Entrepreneur Award from Dr. N. Lingaraju, Principal of JSPS Homeopathic Medical College, Hyderabad, India. Tana, Telugu Association of North America, a prestigious organization, honored and awarded her for selfless homeopathic and humanitarian services at Ladies' Night Out on October 22, Michigan. Also, Dr. Kavita received the prestigious Legendary Homeopath Award with joint hands of Honorable Health Minister Dr. Dhan Singh Rawat, Senior MLA Mr. Harbhajan Singh Chima, ex-director Homeopathy Government of Uttarakhand and chairman of Homeo Cure and Research Institute during the National Homeopathic Seminar, Homeopathy, the Future Medicine at Kashipur on 21st August 2022. Me, Dr. Rajneesh Kumar Sharma, Dr. Deepak Sharma ka executive. We have also recognized and presented with Legendary Homeopath Award at the ceremony. We are proud to announce that Dr. Kavita was honored as the Woman of the Year 2023 from prestigious organization NATA, North American Telugu Association, USA. Dr. Kavita was also honored by renowned DTA, Detroit Telugu Association, Executive Committee on Mother's Day at Michigan, USA with DTA Community Service Award 2023. We're extremely happy and proud that we celebrated 12 years of her book, Beyond the Limits, A Challenge to Prove Oneself, and her second book, Dose of Spirituality with Kavita, also completed its 2 years. The e-book was launched last year in presence of Honorable Guest of Speakers, American Institute of Homeopathy, AIH President, Dr. Alex Becker, and Council for Homeopathy, CHC President, Dr. Sheetal Tiwari at our KHA webinar. At KHA's second annual celebration, our honorable guest of speaker, Dr. Jawahar Shah, Chairman of Enlightenment Education, launched its audio version and hard copy. We have donated over $1,500 to 10 to 15 charities, which we have also listed on the website. Dr. Kavita donated the proceedings of the book through KHA study group platform to various charitable organizations and homeopathic association. To name a few are Kevin Friendly Foundation, CHC, DHMA, JSPS College, BT Seva, NCH, etc. Interested one can reach us for details at studygroup@gmail.com. As of now, we have nearly 450 recordings on professional webinars related to homeopathy, health-related topics, and inspirational talks available on our channel, Kavita Kukunur. This webinar is moderated by KHA family, myself, Dr. Niharika Sapra, KHA volunteer, and Dr. Deepika Balani. KHA volunteer. It is being recorded as we speak. We will take questions at the end of the webinar. We will also post jot form in Zoom webinar chat at the end of the webinar. Please fill the form to receive your participation certificate. Kindly mute yourself and turn your video off for better connection. Now, before proceeding to the scientific session, I would like to invite Dr. Deepika Balani to read the Code of Ethics.
Good evening, ma'am. Am I audible?
Yes.
Thank you for sharing, ma'am. Ethics and benefits of KHA Homeopathy Study Group Pro Bono. To be a KHA speaker needs at least 1 to 2 months of active volunteering. Only KHA speakers' themes are promoted in newsletters and webinars. KHA provides volunteering for 2 to 12 months, respects and inspires volunteers to grow. Active volunteers will be promoted through our website, social media, and added to our WhatsApp group. Articles of the volunteers will be posted on KHA website and newsletter and will be sent for publication at other journals too. Volunteers and speakers are eligible for prestigious KHA annual awards. Volunteers are eligible for KHA inspirational talks. Volunteers are eligible for case discussions. KHA promotes homeopathic organizations as well as their mega events. KHA promotes great work of speakers through their book reviews. Honorable guests may propose their future courses of events after the webinar. KHA maintains a healthy and happy environment, so keeps only like-minded folks. KHA requests everyone to maintain the confidentiality of the group. For more information, please visit our website. Thank you for the opportunity, ma'am.
Dr. Niharika, can you read the disclaimer, please?
Yes, ma'am, sure. Disclaimer: all the KHA Homeopathy Study Group webinars are for educational purposes only and not intended to diagnose or treat a disease. Listeners can benefit with the information shared at the webinars. The opinions expressed by speakers, moderators, and attendees are part of educational experience and do not necessarily represent the position of the KHA Holistic Approach, KHA or KHA Homeopathic Study Group Pro Bono.
Thank you, dear. Now let's welcome our honorable speaker. Let me introduce him to you all. Today we have with us Dr. Shreepad Hegde, MD Homeopathy, having teaching experience of 36 years and in research-oriented clinical practice for the last 39 years at Bangalore. Former professor and HOD, Government Homeopathic Medical College and Hospital, Bangalore. Presently, he is the member, Special Committee of Homeopathic Pathogenetic Trial, Drug Proving of CCRH, Ministry of Ayush, GOI, New Delhi. Member of governing body National Institute of Homeopathy, Kolkata. He's the director of Tattva Homeopathic Research Center, Bangalore. He's the guest faculty NHRIMH, Kottayam under CCRH, Ministry of Ayush, Government of India. Coordinator of Sri Bharti Arogya Dhama, Free Medical Center, Bangalore. Homeopathic consultant of HALCO, Bangalore. Presented numerous research papers and presentations at national and international platforms. He's the recipient of several national and international awards. He'll be speaking the topic Sapere aude, treating cancer, HAHNEMAN'S Way. Welcome, Dr. Shreepad Hegde, sir, to KHA platform, and you can please proceed with your session.
Thank you, Dr. Shweta Singh.
Thank you, sir.
Yeah, good morning or good afternoon or good evening, all that together I will say. I am audible now very clearly?
Yes, sir.
Yeah, it is my privilege and I am very proud to be there on the KHA platform and the hope let us enjoy the session. The name itself says that it is aude sapere. It's visible, no?
Yes.
We have a series of webinars we have been conducted by the Kavita Holistic Approach, and this time, by chance or by mistake, I am there with them. I hope the audience or the delegates who are all there with us, they will enjoy. Still many may be heading here because it's a Sunday. All are in celebration mood. Naturally, they may not have much interest to attend a serious topic like this. And I was working in an institute, a government institute, as a professor. 100% I am a director, Tattva Homeopathic Research Center, and president of one of the local organization, that is Karnataka Qualified Homeopathic Doctors Association. And the name, why it has been selected. See, the Sapere aude means this aude sapere, otherwise you say treating cancer HAHNEMANN'S Way. Sapere aude is the Latin phrase meaning dare to know, and dare to know things through reason. And also is loosely translated as have courage to use your own reason. See, that has been used in the organon of Mater Medica, that said dare to be wise, this, that, so many things. Aude sapere, the word has been put this and that side. But the original word is the sapere aude, means dare to know. Here, why I have selected this, now the of late we are facing so many challenges in our clinical practice, especially the treating the cancer cases, and where many youngsters have been suffering and identified that they have a problem, but they don't know. Where earlier we used to see only at the 5th, 6th or 7th decades of their life, we used to see the cancer cases. It's not like that, now it is advanced. And many cancer cases have been detected only in the 3rd or the 4th stage of the disease. Then, what is the role of homeopathy there? How the cancer is classified as per HAHNEMAN'S Way. It's not an acute disease naturally. Maybe many times where the acute manifestations may come up, where it has been identified with that, but already it might have incited a long period in the body as well as in the mind, but patient has some problem. Then, according to is where the acute disease, chronic disease, indisposition, surgical disease, this is the classification that the HAHNEMANN has made. And here in this, the chronic diseases, we say then where the cancer comes. Many they have classified as cancer as a separate disorder and disease, which was not rampant or so much during the HAHNEMANN'S time. That's why even some I remember where they make it as a cancer miasm also, overruling the HAHNEMANN'S, identifying the miasm as 3. See, diseases with fully developed symptoms, another side diseases with few symptoms. Diseases fully developed symptoms, you see the non-miasmatic chronic disease or miasmatic chronic disease. Pseudochronic, drug disease, all these things have been explained in 77, 74 to 76. Occupational disease, single miasmatic disease, compound miasmatic disease, psoric psychosis syphilitic or syphilitic psoric or a psoric psychotic, psychosyphilitic, whatever the fermentation combination, and by the same time, diseases with few symptoms. Many times you don't notice where there is a lump, there is a mass, there is some discomfort, there is a discoloration. We try to identify why this discoloration is there, why there is a lump, why there is a mass. Then that all comes under one-sided disease. The patient won't know what is happening inside. This is a very thing. That's why I say they see with only mental symptoms sometimes, where the patient feels the fatigue, weakness, a loss of fear, anxiety, some apprehension, loss of sleep, maybe many varieties where the presentations may be there. Only with the physical symptoms, so I said no, where they may have the headache or only giddiness. Even I think the last week, there was a patient, they came with a giddiness suddenly. And there is some echoing sound in the ear. Then where the ENT surgeon has seen that, he said there is no problem with the hearing and all. When we went for the brain scanning, we could able to make it that the patient is suffering from schwannoma. It was a very surprise. See, that's why I said that it's very difficult to decide where the surgical or non-surgical diseases. If you put it in all in one nutshell, cancer comes under this all these chronic diseases, whatever the classification, the main as well as subclassification, everything suits for the cancer patients. That's why it's very difficult to say. The chronic is true, but all the things are true to the fact, and it is left to the physician to decide what and how it may be there. Then the question comes whether cancer is curable or not curable. Is this incurable disease or curable disease? Still, it is a what I say, the $1 million question remains same. The cancer occurs when cells start to grow and multiply at an uncontrollable rate. The most curable cancers are cancers of the thyroid, breast, prostate, testis, and skin. This is the things and how it is decided. Cancer curability is often measured by the 5-year survival rate after the detection or a diagnosis of the particular cancer. As we say, the how you will decide. They say now there is nothing is there even after doing the PET scan and so many investigations. They say that there is nothing is there. The patient is out of danger. Okay, but after 2 years, 3 years, again somewhere where the cancer cell starts growing. These types of cancer are considered most treatable when diagnosed in the early stages. This is very important, where we are supposed to know what is the scope or what is the limitation of the system as well as depends on the patient's presentations. Then, Hahnemann himself says very clearly where the palliation is required, where palliation is required, and palliative care. When palliation care is treatment to relieve rather than cure symptoms and suffering caused by cancer and to improve the quality of life of patients and their families. Palliative care can help people live more comfortably. It is particularly needed in places where a high proportion of patients in advanced stages of cancer, where there is a little chance of cure. Relief from physical, psychosocial, and spiritual problems through palliative care is possible for more than 90% of patients with advanced stages of cancer. Effective public health strategies comprising community and home-based care are essential to provide pain relief and palliative care for patients and their families. Improved access to oral morphine is strongly recommended for the treatment of moderate stem, where the severe cancer pain suffered by over 80% of people with cancer in the terminal phase. Then what is the role? Then H.A. Roberts says very clearly in his philosophy, in incurable conditions, the administration of the similar remedy almost always ameliorates the situation, at least for 3 or 4 days, and usually for a long period. Then we may have a return of symptoms when the indicated remedy will be called into use again. In incurable conditions, the administration of the similar remedy almost always ameliorates the situation. Try to understand, it ameliorates. It's not a cure. At least for 3 or 4 days, then usually for a long period. It depends on the stages, organ involvement, depth of the pathology. Then we may have a return of symptoms depending on these stages. Then when the indicated remedy will be called into use again, or maybe some other complementary remedy may be required. This is very interesting. The phases and layers of this palliative care, how it can be made, living with a life-limiting illness with any prognosis, introduction to palliative approach, symptom management, hospice care or the home supports, ongoing medical treatments as appropriate, condition is non-curative, maximizing quality of life, this is important. Means why I'm showing this means how much we could able to help for the patients, and end of life care like weeks to months to live, or the symptom management, spiritual health care, psychosocial support, or in the terminal cases like a psychosocial support of patients and a family, symptom management, spiritual care, and days to hours of life. The palliative chemotherapy or radiotherapy, what others they give, or palliative surgery. Sometimes that also may be required, where the localized lesion, if you remove, after that you start your medicines. Certainly such cancer patients respond very well. Maximizing community supports, psychosocial support, these are all the very important issues in the palliative care. Then we have a very good important role. She could able to see only the medicine is not the thing. Take the patient into a confidence, the palliative care. Then you could able to help the cancer patients better then whatever the expectations are there, then so don't think like that all the cases are incurable and it is a hopeless cases. It all depends how you approach towards the patient as well as to the disease. See, palliative care maybe the another chart I could able to show that care for cancer. The palliative care can address the following problems for cancer patients and their families. Number one is physical symptoms. The main complaint is that pain, breathing difficulty, nausea and vomiting, mobility limitations, fatigue, and body weakness. See, these are all the things may be there in one patient or each one may be there in a different patients. It all depends on the organ involved with where the patient comes. And psychological and spiritual issues like anxiety, distress, depression, grief, spiritual needs. This is the most important thing. See, once the patient is aware that patient is suffering from cancer, then naturally the anxiety. And they have in the mind that cancer means it is very problematic and it gives a lot of pain, strain, and agony. There is a financial loss. Because of that, the grief and depression is naturally occurs. Then such conditions where they need maybe the spiritual needs, where the support, moral as well as social and spiritual support may be needed for the patient. It is also equally important to keep them into a confidence that we could able to help them. Then, where in the cancer cases is useful. Scope of homeopathy for cancer care is the scope of homeopathy. It varies, depends on type of cancer, stage of cancer, and the general health condition of the patient, comorbid diseases, then intolerance of other treatments like a chemotherapy and radiotherapy. See, why I'm telling this, many times they come in the terminal case stage or where there is a rejected cases or they are in the intolerance of any medicines or there is no other alternative medicines which could be able to help for the patient in any stage. In such conditions, they try to see that any other alternative solutions are there for the system. Then it may be very difficult. That's why I say the intolerance of other treatments also after chemotherapy or before that or the radiotherapy, they will stand in front of you that whether you could be able to do some miracles. Then it may be very problem. As a complementary or alternate therapy. So I am very clearly mentioning. Why I am telling, that's why I said there one should be there enough to accept and say whatever the facts we are facing it and the challenges we accept and we treat and continue with the help of homeopathic system of medicines. Then homeopathy is very helpful because it's a cost effective and without any side effects we could be able to help. A survey of around 1,000 cancer patients in 14 European countries revealed that 36% of cancer patients were using some form of complementary medicines, among which homeopathy is very prominent. See, this is very important information where all we could be able to be very proud about that. And in Germany, homeopathy is the most frequently used complementary and alternate medicines among German adults and children with cancer. This is also very important. Though in the Germany where the homeopathy is slowly declining, but still it is there as a number 2 system of medicine. They use maximum number of patients. And homeopathic treatment improves the quality of life of the cancer patients. See, cancer care with homeopathy, it can be made. One of the most distressing complaints associated with some varieties of cancer is agonizing pain. Conventional medicines can provide pain relief, but only to a certain extent, and these medicines are not without any side effects. There's so much side effects are there, and many times you have seen there's a hair loss, skin color changes, and the side effects will be there. The fatigue, weakness, loss of appetite. There are so many, and we can make a number of lists of signs or the symptoms what the patient suffers. Moreover, there is always a restriction to the dosage that can be safely administered to the patient. The advantage of administering homeopathic medicine in such cases is that there can be effective pain control without any side effects. This is very important. And we could be able to help the patient like anything. Homeopathy can help in improving the general well-being and vitality of the patient. See, conventional treatment options for cancer, surgery, chemotherapy, radiotherapy, etc. are associated with distressing side effects, and homeopathy can play a definite role to counter these side effects. But I'm telling, where even after surgery, means post-surgical cases of cancer, or post-chemotherapy of cancer patients, or even post-radiotherapy, or sometimes combination of all these three, we have a very effective medicine, we could be able to help the patient like anything. The diagnosis of cancer often leaves the patient with a sense of depression, anxiety, and the fear. This is what I was telling. Usually, many times where the relatives, they say very clearly, no, we are not informed that the patient is suffering from cancer. But of late, it is very difficult to keep it as a secret because they are aware where the patients have been taken to the oncologist or a cancer hospital or any such investigations have been made. They know, but inform them that it is a harmless and take them into a confidence, then start treatment, and it may be more effective if you inform them and take them into confidence and start treating, because they are also psychologically ready to face whatever the symptoms or the manifestations appears. Then slowly they will accept that. Then it will be very easy to treat such patients. The treatment may induce additional irritability, impatience, and mood fluctuations. This is because of the disease. Another one is because of their nature of accepting the things. Homeopathy can influence the psyche of the patient and help him or her to deal with these symptoms in a better way. And homeopathic medicines may also have a role to play in controlling the progression and spread of the disease to other organs. Naturally, see, where I have seen many patients, we could able to arrest the further growth or the secondaries which may occur in the other organs or to the other parts of the body, we could able to make it. Then homeopathy should be people's medicine. Why I'm telling this? Still there's acceptance is needed. I'm not talking just in India, it is all over the world. Then how it can be made? Needs a very scientific research on various cancer diseases in different stages. See, here, one sentence only said where it needs a scientific research to accept by the society on various cancers, and in that cancers also in a different stages. What is the role of these homeopathic medicines? What the physiopathological changes takes place? What the organ changes takes place? What at the molecular level or the biochemistry level, what changes are taking place? With such results happens, then it will be very easy, and then only it will become a people's medicine. Then see, wherever you see the cancer treatment options, you could able to see this chart. Here, what are the things are there? The hormone therapy, surgery, bone marrow transplantation, chemotherapy, targeted therapy, radiation therapy, immunotherapy. See why there is no homeopathy in this. Add homeopathy in this chart. See, it has also an option for cancer treatment. That's why they add addition of this homeopathic treatment is homeotherapy or homeotherapy. Homeopathic treatment is also equally important thing we had once supposed to know. And many oncology hospitals, big cities like Mumbai or Delhi and Bangalore, where these cancer hospitals, they have started the Ayush OPDs in their hospitals to take as a complementary or alternative system of medicine, where it could able to support the treatment of the patient, and it should develop in all the areas wherever the cancer patients are more. Then, do homeopathic medicines can be administered along with the allopathic medicines? Because this question comes whenever the patient comes and stands in front of you, now already taking so many medicines. I say that's why it's a big yes, I have made it. That is, one should be dare enough to say that yes, even along with the allopathic medicines, whatever they take, the homeopathic medicine works equally and very effectively. One should have a very firm knowledge about this, and you could be able to accept the facts. In 2017, the World Health Assembly, this is under the working for World Health Organization, passed the resolution Cancer Prevention and Control in the context of an integrated approach that urges governments, and see, this is a very important thing where they urge and WHO to accelerate action to achieve the targets. But see, sometimes, where resolution passes, but on ground reality, it may take its own time, or there are some reasons which could be able to fall back. Because in the 2019, again, the COVID started and every attention has been deviated towards the COVID, and still we have to come back to this resolution. Then let me discuss in short. I'm not going in detail the what medicines have been selected on what basis and all that things in detail, because just I will put it that how the patient's approach will be there. This is a case of cancer of stomach. I'm telling the diagnosis very clearly. In Bangalore, there is a world famous cancer institute is there that is called KHA. It is especially only for the cancer oncology hospital, well equipped and fully furnished hospital. Almost in India, we can say number 1 or 2. After Tata, I think it stands, KHA stands. Tata in Mumbai. And maybe some other hospitals may be there, but we know. And there they have diagnosed that the cancer of stomach and it is in a terminal stage and he may not live for another 3-4 weeks. And they sent him. It's of no use. Then his main complaint was very severe burning and vomiting will take place after 2 to 3 hours of taking the food and nothing will stand. Very interesting thing is that in the first visit, they didn't inform me. All the reports and everything was there. They came with a hopelessness that there is no medicines and no surgery or the chemotherapy will be helpful because already secondaries have been set in and he's already 82 years old and it may not be much useful to do any surgery and there are so many things, they were bypass, they have to make it and the opening the things and it's all harmful. Patient may die during surgery or any such treatments. Instead of that, let him go naturally. This is their approach and they didn't give any medicine also. Then when they came to me, I just examined and we started some medicine. And initially I was in the impression that the patient may be helpful of his burning and other nature of the things where arsenic I have started. I'm telling very clearly. Then next visit when they came there, then his daughter-in-law said very clearly that then he searches always the cold food and cold things and he opens the refrigerator and he used to drink either cold water or anything which is very cold, ice cold things. And there was a birthday party of the grandchild and he has seen that ice cream has been kept in the fridge and he used to take and in the night, overnight, he has finished up. Then this is a very clear, that's why that children, they have kept that ice cream Ajja. Ajja means the grandfather. See, this is how has been identified and everyone, you are aware of your therapeutical knowledge that where the ice cream or the cold things, the ice cold thing will give a relief for the burning. And the stomach cancer, one of the main symptom is burning pain, very severe burning pain, like a fire. See, here there is a cancer repertory page is there, the cancer stomach. You could able to see acetic acid, arsenic iodide, bismuth, cadmium, capsicum, carbolic acid, carboanimalis, conium, kundurango, and creosote, lacasis, hydrastis, lycopodium, mercur, mesothelium, phosphorus. See, here actually now you could able to tell the phosphorus is the medicine. Where I started the phosphorus, you may not believe, patient could able to eat something, his vomiting sensation came down, the severity came down. I told the family members, let him enjoy the ice cream, don't bother about that. That is giving him a relief. You are in the wrong impression that it may create some cold or some problem for the patient. No, that is giving him relief. Let him take either a cold milk, ice cream, or any cold things, not a cold drinks like a beverages, which is aerated soda or anything, but the plain, where she may not believe he could able to have his a continuous life, where they told so some 3-4 weeks he may live. He lived for more than 7 to 8 months after that, and one fine early morning, he passed away without having any much discomfort. And this is only the phosphorus was the medicine which could able to help for the patient. This is a very interesting case. That's what I'm telling. But we don't know whether we could able to apply this for all the patients as a uniform or we have to check it. But there the very classical indication was there and we could able to help the patient and he had a easily and comfortable life. Then, see, these are all the therapeutic values. The stomach cancers, arsenical, phosphorus, and lycopodium. Then some more hints for so viewers. Say the medicine for colorectal cancer are alumina, arsenic, aloe, and nitric acid. Alumina is the best remedy when constipation of the severest form is present in patients of colorectal cancers. Of late, it is more, where we see because where irritable bowel syndromes have increased, maybe our food habits or the style of living and so many things may be counting that. The stool remains in the rectum for long without any urge to pass it. Alumina is the remedy. Then other remedies like carboanimalis, conium, kundurango, bismuth, and carbolic acid. These are all the I'm talking about the most indicated medicines where I have used in my practice for this many years. This is what I'm showing here. See, this is another case. In brief, in short, whatever the time available where I'm discussing with you. Okay, where this is the cancer breast, invasive lobular carcinoma of the right breast. You could able to see the lady of 78 years old, where I examined, there was no wound. This is at the last stage of the wound where you are seeing now. This also after application of echinacea and internal medicine, it is in this stage where she has been identified, where only it is restricted to the axillary lymph nodes, other body parts are free. It is in the second stage of cancer, what has been detected by the oncologist, and they advised for the mastectomy. But the lady was very strong, having a good willpower. She said, no, I am not undergoing any surgery or any chemotherapy. If I am going to die, I will die with this. And if any other medicines are there, we will try it. Then being his son being a yoga therapist as well as let me say the naturopathy doctor, he said, no, no, let us try the homeopathic medicines. And we started treating her actually, where she didn't have any pain. She used to do all her work, only except her osteoarthritis because of the age factor. After 3-4 years, that has developed. And after 4 years, she developed this ulcer. And at the localized area it came, and it has been that lump which was there as a protrusion outside, that has been removed, local resection has been made, and this is the ulcer, post ulcer also. Even I only have treated with our medicines. And she responded very well with the medicines like econium, phytoleuca, as well as thuja, and she lived her life. And I think last 6 months back or something, she expired with a natural senility death, not because of the cancer. I'm very proud to say that. Then this is another case, very interesting case, where there is a invasive ductal carcinoma of the breast. I think for the study purpose, I have kept both the breast where you could able to see the right side breast where indrawing nipples, and you could able to see the markings and even hanging down. Any undergraduate could able to diagnose the case where patient have a heaviness over the breast, and there was a problem, except that she is a very hale and healthy. She is somewhere around 62 years old lady, a village housewife, and his son brought her. When I examined, there was a lump, very solid hard mass, but axillary lymph nodes and all were normal. But still, we sent to take the oncologist opinion. I'm very clearly I'm telling, because I didn't like to try anything without any base. Then they did a biopsy. They confirmed it is ductal carcinoma, and they advised surgery. See, mastectomy has been done. Medical mastectomy has been done. After the discharge of the same day from the hospital, they came to my clinic and consulted me. Sir, this is the thing. She was showing actually, the removing her clothes. She showed that, sir, this is the thing has been done. Now, I don't like take any of their medicines. You please treat me. You may not believe, 3 years back, we have treated, 3.5 years back. It has been done. After that, she has not gone to the oncologist at all. Still, she is there. She is very comfortable. No secondaries. Even I think some 6 months back, we did a PET scan and all. She is very fine. And she is just purely on our medicine. And this is another case, an example for that, where the homeopathy could be able to help. And we have to see, now the 3 years, 3.5 years are over. The 5 years means really it is a good life for her. Then, what are the remedies? Just for our thinking purpose. Now we may be curious to know that what medicine sir might have given to this patient. Homeopathic medicines for the treatment of breast cancer are conium, phytoleuca, hydrastis, and Asteria rubens. You are all aware of that. I am not telling. But which medicine should be selected when? Or both the medicines should be selected. Sometimes it is very difficult to decide which is to be given. See, the conium and phytoleuca are prescribed for hard lumps with pain in the breast. Sometimes conium is a very silent, like a silent stone. It's hard, just nothing will be expressed. But phytoleuca, at least hardness, along with that, the pain also will be there. Sometimes it is intolerable pain. Hydrasis is a very beneficial when sharp cutting pains are there in the breast, predominates with the retraction of the nipple. This is what typically you are seeing that. Excessive emaciation and weakness along with the breast cancer point towards the ulcer, that is hydrastis. Then Asteria rubens is a very beneficial medicine for not only early stages of breast cancer, but also the stages when ulcerations have set in. At this stage, this homeopathic medicine is used when the foul-smelling discharges are evident with acute pains that may be of piercing or stabbing in nature. And along with that, the hydrostasis also. It's the same way. This is another case. Invasive inflammatory carcinoma. See, for your information, I will tell you, this was 2-3 cases what I was just explaining you. This is all primarily detected by me only. It is not any oncologist who has referred to me. See, there is a challenges for the homeopathic doctors. Once you refer them, they will not come back to you. But of late, last some 4-5 years, I am seeing rampant many number of cases of cancers in my practice. See, this lady, she came with a severe agonizing pain. Where she has been approached to one of the 2-3 hospitals because of her low poverty. She could not able to make a financial this thing. She had developed. You may be seeing the gigantic personality of this lady. See how robust and strong. And she is actually a labor class lady of some 46, 47 years old. See, she is only the holding her breast. You could able to see her from her left hand. She is lifting. Literally, it was so heavy. In one hand, I could not able to lift it, and she only said, "No, sir. See, sir. This is the thing. It's so much heavy." See, sir, the heaviness is there, hardness is there. It was literally stone. See, what you are making, and there is ulcer formation is already set in, and from this there is a false smelling discharge was there. And in this stage, where what is to be done? Will accept this case or will reject it or will send them out? Because he said she has gone to some hospitals, they have rejected because she didn't have some health cards or she didn't have sufficient money. Literally, I cried in front of her. See, that is the situation where we see so many such cancer patients in India of late now, and many they are dying because of the disease. And in such conditions, at least our medicine doesn't cost anything. Or if you give a treatment to such patients, some free also, nothing will go wrong. We will not suffer because of any financial loss. And I started the treatment, and literally, you not believe, where her pain, at least we could able to give some life. The pain, this is only some 3-4 months back what I have seen. Still she is under the treatment and observation, and in between we are trying to contact the oncologist also. Both the processes are going on. But after starting the medicine, at least some pain she could be able to tolerate. She was literally crying. And a very interesting thing is that she was sitting. So until she removed the clothes, what is her problem? She said chest pain. I was in the impression maybe because it's a menopausal age, some hormonal changes are there. That's why she is complaining breast pain. Then when she removed and she showed, sir, this is the thing. And any undergraduates could be able to diagnose even otherwise also. And she knows that it may be very dangerous disease. By constitution you treat, or by disease you treat, or the local organ you treat, or in the local organ manifestations like a false swelling discharge with an ulcer. See which one you treat. You decide. We will discuss that. And this is another case for you. I think maybe some 2 years back, he is a software engineer from Guwahati, is working in Bangalore, actually where he could not able to open his mouth. See, and this gentleman having a pan chewing, the tobacco chewing from his age of almost, he says, 13 or 14 years of age. He used to put in over the tongue or the side of the cheek, and used to say, and he has developed. He could not able to open his mouth. See. And initially we started the treatment, and slowly at least some opening he could able to make it, we could able to visualize. See, after a month, this is the thing in center photo, what you are seeing it, this is after treatment. He could able to open his mouth. Then we have been taken the help of oncologist also, where the local resection has been done. His facial surgery has been done as a plastic surgery. There are so many things, but still he is in continuation of my medicines, and he's far, far, far better. He's just 32 years old, having a 2 small kids. By seeing his family and the children, it was really very pity. But he's very sincere, honest. He said it is all because of the tobacco chewing it has happened. You know, the cancer of oral cavity is a very rampant. I see in India, we have a maximum tobacco chewers are there. And some 15 to 20% of the persons, they get the cancer either a tongue or the cheek, the oral cavity of any other organ. That is very commonly we see. See, then how we will identify? As per Hahnemann's way to manage the cases, we have to identify the following things like predisposing factors, diathesis, temperament, constitution, and miasmatic background. See, if we go in each one has got, it takes minimum 1 hour or 2 hours to explain that what are all the things, why it is needed to select a medicine. But still, if we understand all these things, it's very easy. This is what he says. But out of that, to treat some of the cancer cases, we may have to apply out of the box thinking and to give some medicines. To treat renal cancer, some of the therapeutics I am giving here: Chimaphila, Formica rufa, and Solidago. Chimaphila is given to patients of renal cancer when the urine contains blood and mucus. A burning sensation accompanies urination. The person has to strain to pass the urine. Some small indications have been given here. Formica rufa works well when bleeding occurs when urinating with an increased urge for urination. Solidago is recommended when there is a pain in back, in kidney region. Passing of urine is very difficult and painful. The quantity of urine is scanty and sometimes it's mixed with blood. Then, these are all the nostrils where I have used in the various cancer patients. Just for the information I am just sharing with you. Where carcinosin, bacillinum, medorinum, pancreatinum, placenta, thyroidinum, epitheliomine, and serotonin. Syrinum in especially some of the cases of carcinoma and other things, syphilinum and tuberculinum. Then, these are the some other tinctures in cancer patients. I'm sure telling that whatever the things I have been used, that's why with what I said, with confidence, or I am very strong believer of all this, how much it has given a relief for the patient, like arnica, belladonna, bryonia phytolica, passiflora, heclalava, calendula, creosote, and plantago. Even sometimes where I have used the combination also, like arnica and phytolica and all these things. Because when the patient suffers with their pain, the agonizing pain, intolerable pain, they come and complain, really we get confused. It's very difficult to identify any similar. I think on that moment of time, giving a relief for the patient is a more than sufficient. Whatever the damn thing you give. That's why I said where one should be dare enough to accept that what you are doing it. Simply telling them, I gave one dose of Plantago where the patient became all right, that is all not true to the fact. Because one who stands, one who plays in the ground, they know how to kick the ball. See, simply standing on the podium and talking is different. But making a field and practicing in the clinic in front of the patient, it is very tough job. It's not easy. That's why we have acceptance of the things. Then why they come back to you? Unless and until you give a relief. Then the theory comes. That's why I said in the chronic diseases, everything is there. But these cancer patients or the cancer comes under all. You say all miasm, all varieties of diseases, or out of this is something else, a different special variety of disease. Then these are all the restox, mother tincture, cactus grandiflora, chelidonium. Chelidonium is a very handy, especially the abdominal cancers or the splenic organ cancers, and hemamelis, hydrastis, hypericum, ruta, cratagus, and spigelia. See, these are all the very handy mother tinctures where I have taken use of that. The more the allopath grows old, the more he is pessimistic. The more the homeopath grows, the more he is enthusiastic and optimistic. That is true. Because we want to know how best our medicines could able to help for the patient. As I said, in the initial phases only, if they come, then certainly we could able to. See, there is a very interesting thing to say that there is a can in cancer because we can beat it. Very philosophically, I have put a board that I treat, he cures. Because God only knows to whom, when, which cancer to be given, which organ should be affected. God only knows. It's very difficult to predict and pretend also. Here I finish. Thank you. There are so many questions have been arised after hearing all these things. And I thank once again KHA Homeopathy and Dr. Kavita and Dr. Shweta and Niharika and other groups. Thank you very much. Dr. Deepa Raje is also there with us. I think altogether you have brought me to this platform. Certainly there is a beginning of our study, and there are so many issues are there, and cancer is very rampant. And I am ready to answer. Because, see, I am telling the last almost 4 or 5 years, many cancer patients of different varieties we have seen. Even the last week, there was a patient where they say that there is ascites, pleural effusion. Where is the primary cause? Primary cause is at the ovary. A lady of 80 years old. It is a right ovarian cancer which has spread to that. And they understood only patient started difficulty in breathing. That's why they were in and out searching the lungs. There may be a lungs here, but it is not lungs. It is carcinoma of right ovary, which has been spread all over the things. Now at this stage of cancer, what is the role of homeopathy? They come and stand in front of you. You could be able to give them a better answer and give them a relief. If you give a relief, then only they come back to you. Take it granted, I will tell you. Simply vague medicines may not help much. Like that, many. And especially I will tell you the prostate cancers. Prostate cancer also of late it is increasing, and we have a very effective medicine. If you could able to treat in the early stages. And some they come with the prostatic specific antigen. That PSA marker itself only start controlling. I remember maybe some 4 or 5 years back where there was a scientist. He came with the 36 was this PSA marker test. And they have declared that, no, you are already suffering. Yeah, it will not help in any way. You have to undergo surgery. There are so many complications may set in. But you could be able to help patient. That came down and patient became all right. Only with the homeopathic medicines. Otherwise, he was not having a diabetes, hypertension or anything. Otherwise, we see, of late the patient comes with the diabetes, hypertension. There are so many comorbid diseases and it is very difficult to treat them because their resistance is already low. Okay, thank you very much. I don't know, I have not crossed the time, but I feel naturally, being a teacher or a professor, so we don't have any restrictions. We will go on talking. Once again, I thank you one and all for patient listening.
Thank you so much, sir. It was really an enlightening session, really wonderful and worth listening. Do we have any questions, Dr. Niharika?
No, ma'am, no questions. Everyone is just thanking sir for the insights that he has given.
I would like to ask the participants to please mention your questions in the chat box so that we can take up to sir.
No questions.
Sir,
Everyone is expecting more sessions like this. Want to hear some more.
we have some questions. Can you please read them to sir?
Yeah, maybe I think there is a
Regarding
again international conference at Gujarat. I think last week only they have approached. Maybe talking on this, then you could be able to come and attend there. There I may get a more time also to spare. Let us see.
Sure, sir.
the participant is asking regarding potency selection. How to go about
Potency, see, usually I start with the 30, 200, because this is a deep pathology is there, it's very difficult. And if you are very sure where you could able to use a constitutional risk, the first case, for example, what I was talking about the ice cream. In that old man, we started with the 200 and I went up to 10 That really helped the patient a lot, really. Even in the night, suddenly where they have seen that he stopped his last breath, they were so comforted. They said, sir, silently he passed away. We didn't know. Then they called me around morning 3:30 or 4 o'clock. Then they sent me a vehicle. I went there. I only gave the death certificate also. I said, yes, it is fine. At the home, he died very peacefully. That is very important. These are all the things where we could able to get a confidence also. That's what I'm telling. Where it helps, we should know the limitation as well as the scope. Okay, thank you.
Ma'am, regarding repetition of tincture, there is a question that how do
It
we
all depends. It depends. Because if the pain severe, every half an hour also sometimes we give. Or sometimes may not be required, only night one dose is sufficient. Some they complain on the night, the very severe pain is there, you cannot able to sleep. A combination like this what arnica and passiflora or phytolecon passiflora, which gave a very good relief for the patient's comfort sleep. These are things we have to decide depending on the patient's nature and so many other issues also there. I think we may have a some short-time course from KHA for this management of the cancer cases. Then it will be more useful, because just to say some tips like this, that may not enrich your knowledges,
So then someone is asking for all types of cancers, what remedy, how much potency, and I guess you have already mentioned that depending on the case.
Yeah, because of late, our nature is like that. We want ready-made things.
So
Nobody
another
wants
question.
nobody wants atta. They want direct idli. It may not be possible, no?
Are you prescribing single remedy at a time or multiple remedies, or depending upon the case? I
Yeah,
guess
depending on that.
depending
Not multiple remedies means, for example, see that today I might have given for the pain, other discomforts like a colocynth or the Magphos or any such things, or even chamomilla or something. Then the next day suddenly it may change to a bryonia or a belladonna or a glonine or gelsemium. That's why it's very difficult to predict in cancer cases. So today they are fine, and tomorrow suddenly their vomiting may start. They will start complaining. I was talking about that Swanoma case. Happened the same thing. They are from some 400, 500 kilometers away from this Bangalore where I practice. Then immediately next day they started telling, then any patient has started vomiting. Then what should I think? Whether the intracranial pressure has increased, that's vomiting started. But afterwards, after inquiry, I came to know that they had some food while traveling in the train. That is a food poisoning. Whether you treat that or you treat this. That's why we should have a very good knowledge about the things, what is happening with the patient also. Otherwise, over the phone, I thought, okay, intracranial pressure has increased, the patient started vomiting, ejecting the things. But it is not true. It is because of the food, what they ate in between. These are all the things. That's why it all depends.
So then there is this question: if a patient acquired paraplegia after prostate carcinoma metastasis to spinal cord, what could be the best remedy to start with?
Unless and until you see their manifestations is very difficult, no? And for one thing I will tell you, dear doctors, we are not treating the disease, no. Disease we label. We treat the patient, no. The patient one who is suffering from cancer. We are not treating cancer. It's correct, no? Am I right?
Yes, sir.
That's why
Yes.
I said the prostate. See, the prostatic cancers, many times you see the urinary difficulties or passing the stool difficulty. Both the things are there on the spinal cord. See, I remember where there was an ischiorectal abscess. Patient who came with that, they suspected there is a cancer in the rectum, but it was not true to that fact. It is uterine tumor which was giving a pressure over there, and it was a very huge fibroid uterus which was protruding the posteriorly downwards. That's why there are so many things will be there. We have to just see. Okay. Because the fistula has developed there, and that has been labeled as a ischiorectal fistula. See, so many complicated things will be there. But one thing, remember, so maybe many juniors are here where I see, don't just assure and take it granted that homeopathy could able to do everything. And in the literature is mentioned that we have a treatment for cancer. And don't just jump to conclusion and don't give a false assurance to the patient. Say very humbly that we will try maximum best. And patients cooperates. It's nothing like that कि चलो they will उन लोग भाग जाते चलो patient फिर नहीं आएंगे. Naturally, if you say the lie, they will not come back to you. I am 100% sure. That's why we should have a very confidence. Then only patient will come. That's how we could able to see so many cancer patients. I am not an oncologist to say that. But still, they come means they have some hopes. They have seen some results. They have that confidence. Okay? Yeah.
So I think this is probably the last question, that every case of cancer needs to start with carcinosin as the first remedy.
No. That is wrong. Who said that? Is there a
Some-
question? Somebody
Yes. There is this question, that is it relevant that we need to
No.
start?
I have hardly used carcinosin in cancer patients. This is my experience I am talking. See, maybe somebody else may be different. And even I have seen some, what is that, protocol. There are fixed things. You give conium, then afterwards you give ruta, then you give petolica, you tuja. No. There is nothing like that. You start practicing because you are a beginner, you are a final year student. I will tell you, you start and you make your own protocol. Okay, that will be more successful than following somebody's protocol that may not suit for your patient. Now, this is my sincere advice. What I am telling. See, you should have your own protocol. Don't run behind any school's thought. You run behind the Hahnemann's, Kent's, Margaret Taylor's, or Boric or a Boeing school thoughts, certainly you will get success. This is of late, the showman's things, don't just run behind that. It is like a marketing thing. अरे वो क्या है वो लगा वो फेस को सफेद गोरा हो जाएगा. There is nothing like that. That is all wrong things. Because no, I should not say I don't like. That's why here with the recordings going on, I don't like to take any schools or any person's name. But there is also the wrong informations. We should not spread in the society. We are responsible. We are responsible. And what I say that we have to answer to the society what we are doing, and we have to have a record. That's why I said the research is lacking with us. See, many of you might have been treated cancer cases. Maybe one symptom you might have given relief. Have you any record? Have you made any note of that? Have you informed anybody? Have you made a publication? That is not happening, no. That's why we lack behind that. Arey, homeopathy, they can't do anything in the cancer. This has spreading. That should change. That should change. That all you're all very beginners. Certainly, you will have a wide scope to do that. Okay? Yeah.
Thank you, sir. Dr. Shweta ma'am, the questions are over from everyone.
Thank you, Dr. Niharika.
Yeah.
And thank you so much,
Many
sir.
questions are there, but they cannot ask also.
Yeah, but thank you so much, sir, for patiently answering all the questions. And we would like to take the privilege to honor you with the KA Appreciation Certificate. Please accept it from KA Homeopathy Study Group and share. Congratulations, sir.
Okay, thank you.
And thank you so much for your gracious presence and for your precious time in sharing your knowledge and wisdom. Now let's move to our second speaker, Dr. Mamata Kumar, who is associated with us as KA volunteer. She is a BHMS from Pune University, ICR trained, consulting physician, CHS, MLD, MHI Trust. She has contributing articles to NJH, practicing in Bangalore since 2005, and member and resource personnel, MLD MHI Bangalore branch. She'll be speaking on Shining Silver Argentum Nitricum. Welcome, Dr. Mamata, and you may please proceed with your presentation.
Yeah, thank you so much, Dr. Shweta, for sharing, appreciating me, and thank you so much, sir, Hegde sir, that for wonderful and informative session. I just feeling like that you should not stop and continue like that. I just forgot that I have to also talk on this matter. So I'm just privileged and very honored to be a second speaker with you, sir. And thank you so much, Dr. Kavita ma'am, and all my team members, KA team members, and giving me this opportunity to share my views on this platform. And thank you, Dr. Deepa, who referred Dr. Hegde sir. And thank you, Hegde sir, for giving me the opportunity to share my views with you. And so, dear doctors, welcome. And myself is Dr. Mamata Kumar. I am a KA volunteer. And today I am presenting the Shining Silver, presenting the cases on Shining Silver. Is it visible, Dr. Shweta? Hello?
Yes, ma'am. Yes, ma'am.
Okay.
Yeah.
Yeah. So, moving to the objectives of this presentation is the perceiving the evolution and expression of the fears and anxiety by listing and receiving the case, and deriving the attribute state and expression to build a portrait, And we will also convert the expression into a repertorial language and differentiate the remedy and experience the magic of simillimum. So what is the patient suffering from? So let us understand the case. First case. So I'm presenting the cases first and then information about the shining silver, that is Argentum nitricum. So here a male patient, 53 years old, suffering from diabetes and acid peptic disease and cough. He is one of the leader of software company which is in top Forbes 100 in the Forbes list. And he was initially working in USA and he came to India to start a new venture which is very successful. He has two daughters, wife, and he came to us on 16th February 2013. So his main symptoms were that he was having diabetes since 2008, but he came to us in 2013. The PPBS was under control till 2012 without medicines. But since 2012, he was taking these medicines. So that we had given in the modality section. And during the routine checkup, his PPBS was 250 and LDL was 200 to 250. That's the reason he started medicine. Until now, he is totally asymptomatic as respect to the diabetes. So in the respiratory system, since 2000 and 2001, he had a severe cough and throat pain and cannot speak with the irritation and all. So all the complaints aggravated due to cold weather, dust, winter, night, and earlier it used to be once in a 2-3 months and gets better in 2-3 days, but he won't took too much that much of medications. So he also felt the throat irritation due to acid reflux, and since 2005 it is continued once or twice a week, may last for a whole day, and then he took some allopathic tablets and like Nexpro and Sampros like that, and he used to feel comfortable. So it used to get aggravated due to spicy food and or overeating or late eating. So understanding the patient behind the disease. So after we understand his complaint, let us understand the patient behind the disease. So here, this is a pictorial representation of his life space. So what I would like to share with you is that there are the events in the patient's life and what was his thinking, feeling, actions behind this. The patient was from very small town where his father was a running business and mother is very mild and caring lady. Father was very keen that he should study well, and even the brother who had by then shifted to the city wanted him to also come to his city and study. At the age of 10, he was taken out of his very comfortable environment of his home and the village and taken to the school in the city. This transition was very smooth for this patient only because he put a lot of hard work and he was inherently a very articulate, very perfectionist, very hardworking, and he was very, very good in debates and performances with a great effort, even though English language was very new to him. And new in the sense he was not familiar with the English language as fluently as he was in village. But he picked up so quickly and he started participating in so many competitions in school. So we found that this person is very, very hardworking, intelligent, articulate, and perfectionist. On feeling side, he missed his family structure, had lot of fear and anxiety, which was anticipatory. Now, this patient's anxiety, fear were there earlier, but it got worsened after coming to the city and joining the English medium school. So his thinking was that he always wanted to do well and come first and win the prizes in everything, wherever he takes part. So this is how his childhood was evolved. So in the next part, we will understand after he completed his education, he went to the prestigious BITS Pilani for his master's. After completing the engineering, he got top rank and placed in a very good company that took him to US for job opportunity. And he was very, very happy to go there and leading to a very big unit in US and very successful in many projects under him. But along with these projects, there were deadlines and expectations from him, and he was unable to meet that expectations. And because of the lot of work pressure on him, more than his team. So due to which he experiences a constant fear and anxiety, and which aggravated his acidity. So that's when that acidity started. And he felt that it was becoming very, very severe and felt pressure on the chest. So physician asked him to do the MRI scan. And they put him into the MRI machine. And when patient went into the MRI machine and came out, he experienced such a instant fear of closed MRI machine that he decided this is not, he is not able to stay over here in this country, and he took next flight and came to home. That much was the intensity of his fear and anxiety when he was put in the closed space. So now you will think why he didn't know before that, because this was not available to us earlier. So because this kind of experience was not available before also, because he was in the village and he was at home, and he did not know why he developed this panic attack, and he returned back to home and was taken for counseling for 2 weeks. And the problem started on the 2008 when his partner friend passed away. That left him with lot of anxiety, because now he did not know how to move ahead with his work. As slowly the number of projects were coming down, and he started feeling difficulties to run his company. And this is when diabetes and throat problem started. He was always feeling that he will never be able to perform since the time his friend left, because that was never his area of strength. His area of strength was his multiple ideas, and ensuring these ideas will help to company with getting the more projects. So what was his daughter's input about that? So they said he is a natural leader and talks very well. He has many friends. He keeps everybody positive in the company, and he does not like to fail. And this is the first time in 1 to 2 years that the projects are drying up, and that is he's experienced the fear of failure and very, very anxious. So in the personal history, there is a very characteristic anxious dreams he had, very, very chilly, and he has gained the weight in 2 years. But he didn't know that why he started gaining weight, because he was on the strict diet and and exercise also. He used to do it regularly. And what other observation we noticed, that he came on the very right time, and actually 5 minutes before the right time. And he wore the neat formal dress, kept his mobile switch off so that nobody can disturb him, and he can share all his complaints very well. And already he had given the history form, but even though he shared his all the complaints very well, and then we have to understand how it evolved this totality and build the portrait of by using very, very characteristic form by the evolutionary totality. So this is his evolutionary totality. In this, that first we'll go to the soil, that he has a father and grandfather who were diabetic and but uncontrolled with the medicine. So we have a history of one person in the family having the cancer, and one person died of heart attack. So fundamental miasm was more psychosyphilitic. And in the soil, mother was very fond of him as a child, and his family was very, very keen to send him to his brother's house. With when the shift happened from village to city, the patient, you see that left hand side, that missing his family a lot, getting separated from the support structure in the new family. He does it feel it. Even the brother look after him very well, but he is not able to express anything, and he was always had a fear of performance and failure, which generates the palpitations, and his performance debate. Before that, he had a sleeplessness. Now, on the right side, when the deadline's pressure came, he experiences the anxiety that aggravated the acidity, and the MRI room that created intense fear of closed space with fear of dark and future, and extreme impulsive decision that he had taken, and he came back to India. And this was the time the stomach burning aggravated, and with the sleep disturbances for 2 weeks, Then we find one more event that his friend passed away. He felt fear of failure and the projects were drying up, so diabetic started. So what do we derive the center column from these peripheral events and expression is that patient is very, very hardworking and channelized in his work and a lot of intelligence and perfectionist, but always on the an instance of fear and anxiety attached to the family comes down with the somatization of the palpitations and due to anxiety, stomach burning, and with the sleep disturbances and diabetes. So the first impression in a very successful, ambitious patient, I was thinking of lycopodium. Because as a team, we felt that how many patients of lycopodium do we know that we will get fear in the MRI room or experience the intense fear and decide to leave the job and come back from that country. So let us repertorize and see the kind of remedies coming up. So we are missing something here. So this is the picture behind the lycopodium. So we had taken this repertorial totality that elements from anxiety, anticipatory, fear of narrow space, fear of future, fear of failure, fear of undertaking anything, impulsive, chilly, fears for sweets and fruits, sweat on face and neck, and dream anxious. And after repertorization, the remedies came up as arsenic, sulfur, lyco, and the argentum nitricum. So let us understand the structure of this case. So this is a very intelligent and hardworking patient with the multiple ideas and able to channelize that ideas creatively in the work area, able to concentrate and get the kind of support system and required for his work. Very, very perfectionist and see what kind of dress he wore and detailing everything that he gave in the interview and at the same time very very impulsive and fearful and anxious. So as he was craving for the as a physical data we had that he was craving for the sweets. He covers three locations, that throat, this pharyngitis, mucous membrane of stomach and glands, and non-diabetic dependent diabetic mellitus, non-insulin dependent diabetic mellitus. So how do we compare between the Argentum, arsenicum and lycopodium? So all of them are performance oriented, intelligent and perfectionist. So what is the difference between these three? In Argentum, there is a constant need to shine. It's a constant fear and anxiety because there is a feeling that he is not adequate and due to which he has to keep proving for that and himself and because of which he develops fear of failures and these are something remains with the patient right from his childhood and he also has a fear of narrow spaces which is very very characteristic in that and along with the palpitation and the stage fear. In contrast, in arsenic, the anxieties and fear comes at very peculiar epochs that in the patient life not always we get it. Only when he is not able to perform or after many struggles, he breaks down with the anxiety and with a great restlessness, he predicts the time of death that we know. And now how we'll differentiate with lycopodium? In lycopodium, the performance is coupled with the anxiety, but patient is able to overcome that anxiety because of his natural leadership qualities and his ability to control, have the power to get work done, and he will never allow the anxiety to this much impulsive decision which our patient had taken, and he flight from US to direct India. So he will use his ability to more for his own benefit and own ambitions and progress. So only breakdown of lycopodium is when he loses his position, control, domination, and that time he will come down with the great irritability, not like our patient. Other areas like how does Argentum adapts, no many performances and channelization is common in all three remedies. So, however, in Argentum, if he has a multiple ideas, he needs to find out creative outlet for it. He does not find the creative outlet, he will break down and with lot of physical complaints. In arsenic, when the high degree of perfectionism and the mistrust he has in his environment, he does not let him match the ambition. That is when arsenic breaks down. And in lycopodium, when he will not able to save his position, control and domination, then he will break down. So here almost all of them are psychotic or syphilitic more than lycopodium. And the tissue affinities are mind, mucous membrane, stomach, bone, in argentum, and they have the old dried up look because of the anxiety, and they interact with very known people only. So relatively, the lycopodium does not exhibit his kind of anxieties and restlessness like the argentum and arsenicum. So now follow-ups that what we gave. So we gave argentum nitricum daily because we knew that the sugar was under control with the allopathic medicines. So we don't have to give the more stimulus. So we wanted the stimulus only to taper down the allopathic medicines. But about a month, the allopath had offered to see the what will happen if you would reduce one night dose. But after reducing one night dose, we saw sugar was under control, not at a bad level, but HbA1c was 6.8 and his fasting was 118 and ppbs was 165. The allopathic doctor suggested not to change the medicines for 3 months and work on his weight and diet and exercise. So we had taken the confidence of endocrinologist and gone ahead with our treatment. And we continued argentum nitricum 200 daily until 6/8/2013. But and along with the exercise control diet, and his anxiety also came down. He appointed a new manager in his company who was a kind at taking over everything like his friend, and everything was stable until the 10-12. When the daughter, who was also the partner in his office company, wanted to go to US for her further studies, then he was very tense. And now how he will manage without her? And then we gave the argentum nitricum 1 m once a week. And very soon patient was able to adapt the new situation and the change of missing his daughter. He continued to do the business, and finally we kept observing this patient for 2 years until 10-12 from 10 till 2013 to 15. At the last, patient was not on the medication and he was very happy with his work without any anxiety and fear. So we'll take another one case. So in this is also very interesting case because a very highly qualified person, BE, MSc, and MA in yoga, Masters in Human Excellence with PhD in Competency Management, a variety of degrees he had with a variety of different streams, and applied for a degree in Human Resource in US during the COVID time. He started as a production engineer on a lower level and climbed up the ladder to become a vice president for the quality, and now he became the director for Institute of Quality and Leadership. He likes to break down his work and tasks and schedules. He has set up a planning for 3 colleges in the rural setup where he will run a youth and bring them to the factory for work. And this is all he has written to the history form, and he loves interacting with the people. So what happened to this extremely multi-skilled and why he break down? So from March COVID, he lost interacting with the people and his ideas were remained within, and fear of sitting at home, he became a failure with nothing to do. And he was experiencing the sleeplessness and he lost weight and severe gastritis started with low in vitamin B12. So since 1 year, March 2020, he experiences severe bloating and frequent bowels, which goes worst when he has a more anxiety and after eating and better after stool. And he goes through the sleeplessness and poor concentration and no interest in work, intense anxiety about the future because he felt that he don't know what happened in his life after the lockdown. So let us try and understand what is this patient behind the disease. Why did such a accomplished patient with so many degrees and such a creative outlet in the field of work break down by attack of COVID lockdown? So how did the COVID lockdown affected this patient so deeply? So let's evolve his childhood. So he was born and brought up in the farmer's family and went to the hostel in the first grade because his father was very clear that no facility in the village and he must go to the city. for his studies, and he felt very lonely. He did not want to leave his family because he was very comfortable, but he was very forced to go, and he did not grumble and went there and participated in all the activities, and he was very, very focused and disciplined in his all studies, sports, theater, extracurricular activities. And as a childhood, what we can see is that feeling of being the forsaken and lonely, being not loved. And because he went from very secure, loving family to the desert. So this is going away from your life, that support structure, feeling of missing them. And he must do well coming from the rural background. So he had lot of ideas and he implemented it for the company that he used to work, and he is very hardworking and disciplined. So now what happened after COVID? That he developed unknown anxiety and fear of unknown at future also. He suddenly worst experience, severely pressure of the sales, was not able to focus on the creative areas with the ambitions, and the patient experiences sudden vacuum in his working. And up to now, all his ideas were working and were being implemented by his boss, and now he is confined to the closed spaces of his house. He is extremely depressed, and he feels that what he's going to do with the life after when the COVID is made him to sit at home. He felt helpless and does not know how to empower the youth to achieve the sales target. And suddenly he felt that there is no work, there is no outlet for his creativity and his multiple ideas. So there is a depressed state, sleeplessness, loss of appetite, and when he used to think when this COVID will go away, when I will go back to my original state. He also applied for the PhD in US. In that, they did not allow people to travel from India. So he got extremely confused in closed room, and he thinks that he is a failure. So these were the intensity with which the patient broke down when the COVID came, and he locked himself up in the house. He also started extremely irritated and with his wife, along with the sad, anxious, and a restless mind. So what we found here, that bowels got aggravated, and the bloating, diarrhea, and the sleeplessness, sadness, and weight loss, anxiety about the future, all after the COVID break. So again, we'll find it, that understand how the patient evolved in the three-dimension figure. The fundamental biasm is a psychosyphility because family history of cancer and osteoarthritis, and he came from the village setup where mother was very caring towards him, and father was very caring but little strict to ensure that he goes out of it. So he develops fear, anticipatory anxiety. But with his hard work and commitment and perfectionism, he did very well in the college, got merit, and joined very good company. He would always sleepless 2 days before the exam, but he used to overcome it. On the right side, what do we see? Since the COVID breakdown, there was sudden changes, and boss and MD were not interacting with him, and he was confined the four walls of his house, and he started experiencing fear of future, failure, irritability, and along with the anxiety, no interest in the work, and being left out by the company, and no one is interested in his ideas also. So he landed up with the sleeplessness and weight loss and frequent bowels. So all this makes up to understand that center column is a very hardworking and anticipatory anxiety, performer, perfectionist, and but inheriting the fears and the forsaken feeling. So we put this in the repertorial totality, that elements from anxiety to anticipatory, fear of closed spaces, sadness, depressed with anxiety, fear of failure, fear of anticipation, restless, anxious, sympathetic, moods alternating, timidity. And after repetition, we found Argentum coming as a top. So what happened when we gave the Argentum nitricum 200? Then we realized that that 200 is a little moderate because we are having so much functional overlay of the symptoms and no structural changes, no pathological diseases. So we changed it to 1 m. By 5th May, all the mental symptoms were better, and we continued with the Argentum. Then June 21, lockdown opened, and he was invited to head a project for online training modules for villages and get back to his original state of putting his multiple ideas in his work. So here all three again are hardworking, but the nitrum has a suppression and emotionally driven patient. So who needs to protect his image because of the silica element in that? Our patient is more like a team player rather than having control and power on the team. So I already explained the difference between argentum and lycopodium earlier in this case. So I have already described in this case that argentum and lyco break down, but in nitrum silicata, the breakdown in the relationship do not work on that because of the nitrum core. So the structuralization, what all I have spoken till now, I will only highlight 3-4 keys. Key area, that is the shining leadership qualities, hardworking, and multiple ideas attached with the family, focuses on the his work with lot of hard work and perfectionism. A shining silver metal that breaks down when his ability to perform don't get the channelization. And where do the cost paid? Cost paid comes in the mucous membrane and of the throat, eyes, gut inflammation, allergies, which travels from sora to psycho. And as an adult, it is similar to childhood, except the location of cosped is more deeper, and it might be affecting the mind like dysthymia, that because of the anxiety. So this is the repertory which we do. And so we'll go through this video to understand Argentum better.
Associated with many religious rituals due to its purity. From the cases, we can generalize that from its conception to its evolution, there are events that separate the child from his environment, making him feel lonely and forsaken. However, its resilience, hard work, and performance ensure that the silver will climb its way up the ladder. The fundamental soil miasm is usually cycotic or syphilitic, on which the seed of argentum will grow. The silver, when conceived, is in contact with mother. Usually, the maternal figure may not shower the love and affection the child wants, or the parental support may be missing as child moves away for studies from this secure environment. Silver Child grows in the soil, performing well in school and living up to the demands of expectations from teachers, parents by his intelligence, hard work. He is a natural orator, friendly, and shines in any company. The core disposition starts evolving as intelligent, hardworking, channelized into studies, attached to family, friends, but has an inherent weak pathway of anxiety and great fears, and these fears get expounded as the patient tries to match his multiple ideas and need to constantly do well. Fears are peculiar and characteristic of performance, failure, closed spaces, building collapsing, etc. When the argentum multiple ideas do not find channelization, patient experiences intense fears and anxiety and palpitations and sleeplessness with inflammation, degeneration, ulcerations affecting mind, nerves, mucous membrane, periosteum. Usually the miasm travels from sora to psychotic to syphilitic. This EET shares with us the centrality, that is the core, the soil and miasm, and expressions, mind and body in one three-dimensional view of the shining silver argentum nitricum. Symptoms from herring are loss of consciousness, loss of memory, can't find the right word, falters in speech, time passes slowly, impulsive, easily frightened, reserved. From Allen, imbecile appearance, foolish expression, great debility and tremulous weakness, gloomy mood, hypochondriac, anxiety which makes him walk rapidly, irritated and anxious, inability to think, cannot find suitable words for his ideas, hence falters in speech, difficulty to collect his senses, unable to conceive an idea, stupid feeling, weakness of memory. Argentum comes close to the hard-working, ambitious achiever Lycopodium, the fastidious, ambitious, mistrustful arsenic. But Argentum is not overtly dominating or irritable, rather more participatory and friendly with his peculiar anxieties and fears.
So conclusion that we often mistake the remedies like argentum with the performing lycopodium or anxious arsenic alb. So EET as a that EET means the evolutionary totality, essential evolutionary totality as a tool that help us to understand the evolution, expression of our ambition, performance, and abundance of ideas and strong underlying state of fears and anxieties and its miasmatic level with the characteristic location, modality, and sensation. And it translate the language of a repertory and expand our knowledge of materia medica. So, study of argentum nitricum from these cases help us to generalize the theme of childhood, that is the forsaken feeling and evolution of fears and anxieties with the multiple ideas and constantly planned breakdown and then when the breakdown happens when the channelization fails and understand the organ affinities and the PQRS data also. So abstraction of intensity of fears and the performance adaptation and breakdown help us to translate our gut feeling to analyzing the processing through SCR so we can expand our repertoire of remedies. So thank you so much for all the participants and for patient listening. And ma'am, Kavita ma'am, for giving me opportunities. All my car team members, my family, they supported me a lot. Dr. Shweta Singh, Niharika, Dr. Deepika, and thank you Deepa, and thank you mainly the Hegde sir that he gave me opportunity to have a second speaker with him. So grateful and so honored. Thank you so much.
Thank you so much, Dr. Mamata, for such an elaborating session and for the discussion on this Argentum nitricum. And Dr. Niharika, do we have any questions in the chat box?
No, ma'am, we don't have any questions.
So I would also like to take the privilege to honor you with the CA appreciation certificate. Dr. Niharika, can you please share? Please accept it from CA Homeopathy Study Group, and thank you for your gracious presence and precious time.
Thank you so much.
So with your permission, I would like to announce the upcoming September event that is on 15th September 2024 at Bangalore. Dr. Niharika, can you please share the flyer?
I'm not having the flyer with me in the device. If you could share.
we will be having our second KHA Homeopathy Study Group Pro Bono Conference, International Conference at Bangalore at Pyramid Valley International Kanakpura RD, Bangalore. The timings will be 9 a.m. to 2 p.m. and it is on 15 September 2024, Sunday. Professor Dr. Shreepad Hegde will be our chief guest for the event, and we will have the sessions from Sir and from Dr. Kavita Kumar, from myself, and from Dr. Rajneesh Kumar Sharma, Dr. Mamata Kumar, Dr. Bhavna Guru Raj, and Dr. Deepika Balani. So we would like to have more and more participants. So please join us for the upcoming event. And for more information, you can contact us you can email us at kstudygroup@gmail.com, or you can contact Dr. Mamata Kumar or the other coordinators for the event. It will be on a hybrid mode, both online and offline. It will be there. And you can find the link also to register at our website, kavitakehomeo.com. Please don't miss the event. And lastly, I would like to thank our honorable speakers for the beautiful sessions we have today, and heartfelt thanks to our viewers and followers to join us today. We have many such informative webinars lined up in the upcoming sessions with many more renowned homeopaths. And for the upcoming webinars info or any other updates, please follow our social media handles on Instagram, Facebook, LinkedIn, and Twitter. If you missed any of the webinar, you can watch it out at our YouTube channel with the name Kavita Kumar. Please don't forget to fill the participation jot form to receive your participation certificate. If you will get it in within 10 days. And I'm really thankful to our KHA volunteers for their continuous support and selfless services with which we are able to organize these webinars in successful manner. And for any other info, please reach us at kstudygroup@gmail.com. Thank you so much, everyone. So shall we end?
Thank you, everyone. Thanks a lot. Very nice. Thanks a lot. Hegde sir, thanks a lot, everyone. See you soon on 15th.
Yeah.
Yeah.
Bangalore.
Goodbye.